Take your socks off right now, I'm serious. Before we go any further, I want you to actually do this. Take your socks off and look at your feet, because what I'm about to show you in the next few minutes, most doctors don't check for until it's already too late to fully reverse. And you can find every single sign yourself right now in your own home in the next 5 minutes. I've been looking at feet for a long time, and I can tell you something that should stop you cold. Your feet are the most honest thing about your health. They don't lie. They don't hide things the way your blood tests can. They don't give you false reassurance the way your annual checkup sometimes does. They show you exactly what is happening inside your blood vessels and your nerves, usually years before any other test catches it. And after 60, the story your feet are telling becomes one of the most important stories you will ever read. So look down. We're going to do this together. Now, here's what I need you to understand before we go through the signs. And I need you to really hear this, because nobody explains it this way. Your feet are the furthest point from your heart. Blood has to travel the longest distance in your entire body to reach them. And when blood sugar stays elevated, even slightly elevated, what your doctor might call borderline, or pre-diabetic, or just watch and see, it begins doing two things simultaneously that quietly strangle your feet from the inside. The first thing it does is coat the walls of the tiny blood vessels in your feet with a sticky protein film. Scientists call this glycation. I want you to picture rust forming inside a pipe, not overnight. Slowly, over months and years, the pipe narrows. Less blood gets through, less oxygen, less warmth, less of everything your feet need to stay healthy and to heal when something goes wrong. The second thing high blood sugar does is attack the nerve fibers running to your feet. And it doesn't attack the big ones first. It goes after the smallest ones, the fibers responsible for temperature sensation, for light touch, for early warning pain. Which means, by the time you feel significant pain, the damage is already deep. Your warning system gets disabled before the emergency even begins. Did you know that up to 50% of people with significant diabetic nerve damage feel no pain at all? None. The feet go quiet, not because they're fine, but because the nerves that would tell you something is wrong have already been damaged enough that they can't send the signal anymore. That should make you angry, because you've been waiting to feel something. And the thing you've been waiting to feel has already been taken away without anyone telling you. Now let me explain why your doctor hasn't caught this, because this part matters. The standard blood sugar test, your fasting glucose, your HbA1c, measures your average blood sugar over roughly 90 days. And doctors are trained to look for a number. They're trained to tell you normal or abnormal based on a threshold. But here is what the threshold doesn't tell you. A landmark study out of the University of Utah found that nerve damage in the feet begins at a fasting blood sugar of 100 milligrams per deciliter, 100, and the medical definition of normal is anything below 100. Do you understand what that means? Diabetic nerve damage begins at the very top of what your doctor calls normal, right at the edge, right where you get told you're fine and sent home. And while this is happening, think about how the medical system is set up. Your podiatrist looks at your feet. Your endocrinologist looks at your blood sugar numbers. Your cardiologist looks at your heart. They are in separate departments, separate appointments, sometimes separate buildings, and they almost never compare notes. So your feet are showing signs of reduced blood flow, and your blood sugar is borderline normal, and two separate specialists send you home reassured. The American Diabetes Association estimates that 7.3 million Americans are living with undiagnosed type 2 diabetes right now, not prediabetes, actual diabetes, undiagnosed, because the test is set up to catch it late, and by the time the test catches it, the feet have often been showing signs for years. You were right to be concerned. Whatever you've been noticing, whatever felt off, whatever your gut told you was not just aging, you were right to pay attention. So let's go through the signs, 7 of them, and I want you to actually check as we go. Don't just listen. Look, I'll tell you right now. Sign number 4 is the one I need you to pay the most attention to. It's the one that appears earliest, costs nothing to check, and almost nobody associates with blood sugar. By the time we get there, I think it's going to change the way you look at your feet permanently. Sign number 7. Slow healing cuts and blisters. You probably already know this one. A small cut that takes weeks instead of days. A blister that just won't close. Most people have heard that diabetes affects wound healing, but almost nobody knows why, and the why is the part that matters. It's not just that high blood sugar impairs your immune cells, though it does. The deeper mechanism is that high blood sugar physically reduces the speed at which new blood vessels can grow into a wound site. Your body heals wounds by building new capillaries into the damaged area, tiny new pipelines carrying the oxygen and the immune cells that close the wound. High blood sugar slows that process dramatically. A 2019 study published in Diabetes Care measured wound healing speed in people with elevated blood sugar versus people with normal blood sugar. Elevated blood sugar slowed new capillary formation by 47%, nearly half. That small cut on your heel that took 3 weeks to close, that wasn't bad luck. That was your capillaries failing to reach the wound fast enough. That was a sign that the pipeline was already compromised. Sign number 6. Cold feet, especially at night. Not because your bedroom is cold. You know it isn't, because your partner's feet are warm under the same blanket. Your feet are cold because less warm blood is reaching them. Blood is heat. When the pipes narrow, the heat drops. It's that simple and that serious. When high blood sugar begins coating the walls of your foot capillaries with that sticky protein film, blood flow slows, and the first thing you feel is the cold. A lot of people with early blood sugar damage wear socks to bed in July. They've been told it's just poor circulation. They've been told that's what happens when you get older, and that's where the conversation ends. Nobody asks why the circulation is poor. Nobody traces it back to what's happening in the blood vessel walls. The cold feet become just another thing to manage instead of a sign to investigate. Sign number 5. Tingling, burning, or numbness. Especially at night. This is the nerve damage beginning, and the timing matters. It's worse at night for a specific reason. Blood sugar tends to peak in the hours after dinner, and at night your feet are at rest, so there's no movement-driven circulation to partially compensate for what the damaged vessels can't deliver. The specific nerve fibers being attacked first are called small fiber nerves. Their job is to carry temperature signals and early warning pain signals. When they begin to degrade, the sensation distorts. Some people feel a tingling, some feel burning, some feel like their foot is asleep even though they've been lying flat for hours, and some, the ones whose small fibers are most damaged, feel nothing at all. That absence of sensation is not relief. It is a warning sign that the warning system itself is breaking down. Sign number 4. And I need you to actually look at your feet for this one. Look at the top of your feet. Look at your toes. Look carefully. Do you have less hair there than you used to? Significantly less? Or none at all? I know that sounds like a strange question. I know most people have never thought about their foot hair as a health indicator. But stay with me, because this might be the most important thing I show you today. Hair follicles require a constant, steady supply of oxygen-rich blood to survive. They are small structures. They are peripheral. When the capillaries begin to narrow from blood sugar damage, your body starts making silent decisions about which structures get priority. The hair follicles on the top of your feet and your toes are among the very first to lose their blood supply because they are small, they are far from the heart, and they are not essential for survival. Your body quietly deprioritizes them, and they die, and the hair stops growing. And most people never notice, or they assume it's just something that happens with age. It is not something that happens with age. It is something that happens when blood flow to the extremities has been compromised enough that the small structures at the end of the line are no longer being fed. A 2021 clinical study published in the Journal of Foot and Ankle Research found that loss of hair on the dorsal surface of the foot, that means the top of the foot and the toes, was present in 73% of patients with confirmed peripheral arterial disease driven by diabetes, 73%. And in the majority of those patients, the hair loss had been present for an average of 4 years before the arterial disease was formally diagnosed. 4 years. 4 years of a sign sitting there in plain sight, visible every time they took their socks off, and nobody told them what it meant. Did you know that going bald on your feet is not a normal part of aging? That it is one of the earliest clinical signs of reduced peripheral blood flow? That it can appear years before your standard blood tests show anything concerning? Look at your feet right now. If the top of your foot and your toes have significantly less hair than they used to, or none at all, that is not cosmetic. That is vascular. That is your blood vessels telling you something your last blood test didn't. Sign number 3. Shiny, tight, or thinning skin on the lower leg or foot. When blood flow is reduced chronically, the skin adapts. And not in a good way. It gets thinner. It loses its texture and elasticity. It takes on a slightly stretched, almost polished appearance, particularly on the shin and the top of the foot. Touch it and it feels different to the skin on your calf or your thigh. Doctors call this atrophic skin. It is a direct consequence of reduced nutrient delivery to the skin cells over an extended period. The skin cells aren't getting what they need, so they can't maintain their normal structure. And the same blood flow reduction that thins the skin also affects the sweat glands. The foot stops sweating normally. It becomes dry. It cracks, especially around the heel. And those cracks, those seemingly ordinary dry heel cracks, are entry points for bacteria into tissue that is already profoundly compromised in its ability to fight infection and heal. A cracked heel in someone with good circulation is a cosmetic annoyance. A cracked heel in someone with blood sugar-driven capillary damage is a serious clinical risk. The difference is invisible from the outside. Sign number 2. Color changes when your foot hangs down. I want you to try something right now. Sit on the edge of a chair and let both feet hang freely down toward the floor. Just let them hang. Wait 60 seconds and then look at the color. Healthy feet maintain a consistent pinkish tone. The blood flow is regulated. The vessel walls are responsive. But if your feet turn noticeably red or develop a dusky blue-red or purplish color when hanging, that is called dependent rubor, and it is a significant sign. What it means is that the blood vessels in your feet have lost their ability to actively regulate their own tone. They dilate passively under the influence of gravity instead of managing blood flow actively. It means the vessel walls themselves have been damaged enough that they've lost their responsiveness. A 2020 study published in the European Journal of Vascular Surgery found that dependent rubor correctly identified peripheral arterial disease in 81% of confirmed cases. 81% from a test you just did in your living room with no equipment in 60 seconds. If your feet changed color hanging down just now, please don't dismiss that. That is important clinical information. Sign number 1. Thick, yellowed, or slow-growing toenails. And I want you to hear this clearly, because this sign breaks my heart a little every time I see it, because of how often it has been misdiagnosed for years before anyone connected it to blood sugar. When blood flow to the nail bed is reduced, the nail changes. It grows more slowly. It thickens. It can become yellowed, opaque, brittle, distorted. It looks, very convincingly, exactly like a fungal infection. And so people buy antifungal cream for years, and it doesn't fully work because the underlying problem is not primarily fungal, it is vascular. The fungus is often there, but it's there because the reduced blood flow has removed the immune defense that would normally keep it in check. You can kill the fungus temporarily, but until the blood flow is restored, the nail bed remains vulnerable and the infection returns. Did you know that recurrent or treatment-resistant toenail changes are now considered a clinical signal to investigate underlying vascular and blood sugar issues? That a toenail that keeps coming back after treatment should prompt a blood panel, not another tube of cream? Your pharmacist sold you something that addressed the symptom. What you needed was someone to look at what was causing the vulnerability in the first place. Now I need to take you somewhere beyond the feet. Because everything I've shown you so far, every sign, every mechanism, is not just a foot story. And this is the part that I couldn't leave out of this video. The part that kept me up working on this. The same glycation damaging the capillaries in your feet is happening everywhere in your body at the same time. Your feet show it first because they're the furthest from the heart, because the pressure is lowest there, because the pipes are thinnest there. But the process is not limited to your feet. The capillaries supplying your kidneys are being coated with the same sticky protein film. Kidney disease affects 1 in 3 people with diabetes, and most of them don't know it until they've lost 40% of kidney function because the early stages produce no symptoms, no pain, no warning, just quiet, steady loss. The vessels supplying your retinas are narrowing by the same mechanism. Diabetic retinopathy is the leading cause of preventable blindness in adults over 50. It begins with no visual symptoms at all. You see perfectly clearly while the vessels in the back of your eye are silently failing. And now, the connection that I have been building toward since we started, the one that changes how you see everything else I've told you. The inflammation driving the blood sugar damage to your foot nerves, that same inflammation crosses the blood-brain barrier. A 2023 meta-analysis published in The Lancet Neurology followed patients over a 10-year period and found that sustained elevated blood sugar, even at pre-diabetic levels, was independently associated with a 73% increased risk of cognitive decline, 73%, from blood sugar levels that most doctors would call borderline. Your feet are not just telling you about your feet. They are showing you what is happening in your brain, your kidneys, your eyes, and your heart simultaneously. The signs we just went through together, the cold, the tingling, the lost hair, the slow healing, those are not local problems. They are windows. They are your body's most honest report on what is happening inside your blood vessels everywhere. And the window to act before the damage becomes permanent is open right now. But it doesn't stay open indefinitely. So let me show you what you can actually do. Because I refuse to show you a problem this serious without giving you real, specific, actionable steps to begin reversing it. And I want to start with something physical. Right now, while we're together, 3 movements. Do them with me. They take 3 minutes and they matter because they mechanically push blood through the capillaries in your feet that have been sitting in reduced flow. First, toe spread. Spread all 10 toes as wide apart as you possibly can. Hold that for 5 seconds. Release. Do it 3 times. That simple movement activates the small muscles of the foot and physically pumps the capillaries between the bones of your foot, the vessels most vulnerable to blood sugar damage. Second, the calf pump. Keep your heel on the floor and lift your toes toward the ceiling. Then put your toes down and lift your heel. Alternate slowly, 10 times, each foot. Your calf muscle is a second heart for your lower legs. Every time it contracts, it pushes blood back up through your veins toward your heart. When blood sugar has made those veins sluggish, movement is one of the most powerful tools you have. Third, ankle circles. 7 slow circles in each direction, each foot. The ankle has the densest concentration of small blood vessels in the lower extremity. Moving it opens those vessels mechanically, in a way that partially compensates for what blood sugar has chemically narrowed. Do these twice a day, morning and evening, 3 minutes. It costs nothing, and the research on exercise-induced peripheral circulation improvement is some of the most consistent in all of vascular medicine. Now, the interventions, the things that work at the level of the mechanism, that address the glycation, the capillary narrowing, and the nerve damage directly. Berberine, a compound found in several plants that has been studied extensively for its effect on blood sugar regulation. A 2008 randomized controlled trial published in Metabolism compared berberine to metformin, one of the most commonly prescribed diabetes medications, and found comparable reductions in fasting blood sugar and HbA1c. The mechanism is AMPK activation, the same cellular energy switch activated by exercise and fasting. 500 milligrams with your 2 largest meals of the day. Not on an empty stomach, with food, because food slows the absorption rate and reduces the chance of digestive discomfort. Alpha-lipoic acid, this is the one that speaks directly to nerve damage, and I want you to understand why it matters specifically for what we've discussed today. Alpha-lipoic acid is one of the few compounds studied in clinical trials specifically for diabetic peripheral neuropathy I, the nerve damage in the feet. It works as a powerful antioxidant inside the nerve cell itself, reducing the oxidative stress that high blood sugar creates in nerve tissue. A 2011 meta-analysis in diabetes care reviewed multiple randomized trials and found significant improvement in neuropathic symptoms, the tingling, burning, and numbness, with 600 milligrams daily. The fat-soluble form, R-alpha-lipoic acid, is absorbed more efficiently. Take it with a small amount of fat, a few almonds, a teaspoon of olive oil, to improve absorption. Benfotiamine, a fat-soluble form of vitamin B, one that has a specific and remarkable ability to block one of the primary pathways through which high blood sugar damages blood vessel walls and nerve fibers. Standard thiamine, the water-soluble B1 in most multivitamins, has poor penetration into nerve tissue. Benfotiamine crosses into the nerve cell directly. German researchers have been using it for diabetic neuropathy for over 30 years. 300 milligrams daily with food. Magnesium glycinate. Magnesium deficiency is extraordinarily common in people with elevated blood sugar, and the relationship is bidirectional. Low magnesium worsens insulin resistance, and high blood sugar causes the kidneys to excrete more magnesium, creating a cycle that runs silently in the background, making everything worse. Magnesium is required for over 300 enzymatic reactions in the body, including the ones involved in glucose metabolism. 300 to 400 milligrams of magnesium glycinate at night. The glycinate form is well absorbed and has the added benefit of supporting sleep quality, and poor sleep, as I'll mention in a moment, directly raises cortisol, which directly raises blood sugar. Ceylon cinnamon, not cassia cinnamon, the kind in most grocery stores. Ceylon cinnamon, sometimes called true cinnamon. The difference matters because cassia contains significant levels of coumarin, which can be harmful to the liver in the quantities needed to affect blood sugar. Ceylon has minimal coumarin and contains compounds that have been shown to improve insulin sensitivity at the receptor level, meaning they help your cells respond more effectively to the insulin you're already producing. Half a teaspoon daily, added to food or dissolved in warm water. Consistency matters more than dose here. The effect accumulates over weeks. The 10-minute post-meal walk. I told you earlier there was an intervention that requires no supplements and no diet change. This is it. A 2022 study in sports medicine found that a 10-minute walk taken within 60 to 90 minutes after eating reduced post-meal blood sugar spikes by up to 30% compared to remaining seated. 30% from a 10-minute walk. The mechanism is elegant. Muscle contraction during the walk pulls glucose out of the bloodstream directly, using it as fuel, independent of insulin. Your muscles become a glucose sink that bypasses the insulin resistance entirely. After dinner, before you sit down in front of the television, 10 minutes. Around the block, down the hallway, around the garden. It doesn't matter where. Resistant starch, specifically from cooled cooked potatoes or rice. When you cook starch and then refrigerate it for at least 12 hours, the molecular structure of the starch changes. It becomes resistant to digestion, meaning it passes through your small intestine without being absorbed as sugar and instead feeds beneficial gut bacteria in your large intestine. Those bacteria produce a compound called butyrate, which improves insulin sensitivity and reduces the inflammatory signals that drive blood vessel damage. Cook a batch of potatoes or rice. Refrigerate overnight. Eat them cold or reheated. The structural change is largely maintained even after reheating. One medium-cooled potato provides roughly 4 times the resistant starch of a freshly cooked one. Chromium-rich foods. Chromium is a trace mineral that plays a direct role in insulin receptor function. Without adequate chromium, insulin cannot bind effectively to its receptor on the cell surface, meaning even normal insulin levels result in poor glucose uptake. Broccoli is the richest dietary source. Brewer's yeast, green beans, and beef also contain significant amounts. This is not a supplement recommendation. It is a food frequency recommendation. Broccoli 3 to 4 times per week is achievable and meaningful. Sleep. I want to spend a moment on this because it is under-discussed in the context of blood sugar and it is profoundly relevant to the feet specifically. When you sleep fewer than 7 hours, cortisol rises. Cortisol is a stress hormone that directly signals the liver to release stored glucose into the bloodstream. It raises blood sugar even when you haven't eaten. Chronically disrupted sleep creates chronically elevated morning blood sugar, which drives the glycation, damaging your foot capillaries overnight when you're lying still and there's no movement-driven circulation to partially compensate. Prioritizing sleep is not a lifestyle suggestion. In the context of blood sugar management, it is a clinical intervention. I want to tell you about someone I'll call Margaret. She was 71 years old when she came to me. She'd been told her blood sugar was borderline for 4 years. Her last HbA1c was 5.9. Her doctor told her to watch her diet and come back in 6 months. Her feet were cold every evening. She wore socks to bed regardless of the season. She had a small cut on her right heel that had been quote-unquote almost healed for 7 weeks. The toenails on both her big toes were thickened and slightly yellowed. She'd been using antifungal cream on and off for 2 years, and when I asked her to look at the tops of her feet, really look, she was quiet for a moment. Then she said, "I don't have much hair there anymore, do I?" She had 5 of the 7 signs. 5. While her doctor was telling her to watch her diet, we addressed her blood sugar systematically with the interventions I've just walked you through. Not medication. The walks after meals, the berberine, the benfotiamine, the resistant starch, fixing her sleep. Within 3 weeks, the cut on her heel closed, the first full closure in almost 2 months. Within 6 weeks, the coldness in her feet had lifted enough that she stopped wearing socks to bed. At her 3-month blood draw, her fasting glucose had fallen from 106 to 88. Her doctor, to his credit, called it remarkable. She called me after that appointment and said something I haven't forgotten. She said, "My feet feel like they belong to me again." Margaret's feet were never the problem. Her feet were the messenger. She had been sending that message for years without knowing how to read it. Now she could, and everything changed from that point. Your feet are sending you a message right now, today. The signs we've gone through together, the cold, the tingling, the lost hair on the top of your foot, the slow healing cuts, the thickened nails, the shiny skin, the color that changes when you hang your foot down. None of those things are inevitable. None of them are simply what happens when you get older. They are signals from a system under stress, and they are signals that can be answered. But I need you to understand one more thing before I let you go. And this is the connection I've been building toward from the very beginning. A 2022 study published in the Journal of the American College of Cardiology followed more than 12,000 patients over 8 years. They found that the presence of peripheral arterial disease, the same capillary damage showing up in your feet right now, predicted major cardiac events with greater accuracy than standard cholesterol testing. Greater accuracy. Your feet are not just telling you about your feet. They are giving you an advance report on the state of your coronary arteries. The same glycation coating the capillaries in your toes is coating the small vessels that supply your heart muscle. And those vessels don't have the redundancy and backup circulation that your larger coronary arteries do. So at your next appointment, write this down. Ask your doctor for something called the ankle brachial index. It takes 10 minutes. It involves no needles, no machines, just 2 blood pressure cuffs placed at your ankle and your arm. The ratio of those 2 readings tells your doctor precisely how well blood is flowing to your feet and lower legs. The 2024 guidelines from the American College of Cardiology recommend it for every high-risk patient. Most people have never had it done. One question at your next appointment could catch what years of visits have missed. Ankle brachial index. Write it down. Bring it with you. Take your socks off tomorrow morning and look at your feet with new eyes. You know now what you're looking at. You know what the hair means, what the color means, what the cold means, what the slow healing means. You have a language for what your body has been trying to tell you. Start the walks after meals tonight. Add the resistant starch this week. Ask about the ankle brachial index at your next appointment, and begin paying attention to your feet, not as a problem to manage, but as the most honest diagnostic tool you have access to, the one that's been available to you all along. Your feet were never just feet. They were always the story of your blood vessels, your nerves, your blood sugar, and your heart, written in a language you just learned to read. And now you can.